And now we have Dr. Ronnie, who needs absolutely no introduction to KSO circles. He works in Shankar. He's a big person as far as GSI is concerned, ex-secretary. He was telling us about epidemiology and with landmark studies.
Thank you, Dr. Smita, for the invitation, and Thomas for the kind introduction. So I'll basically just run you through the epidemiology of angle closure in India, and those are my, okay. So basically, the information that you have that I'm going to present is from these 6 studies that have been done across the country. And what you're going to see over here is, okay. So the 6 studies that I showed you all basically looked at how many people in a population-based subset had glaucoma. In addition, these 2 studies looked at it longitudinally, what happened to patients over time. And some of the longitudinal data that I'll present will be from these 2 studies. So if you look at the prevalence of angle closure disease, you can see huge variations in the number of PACS that have been reported. If you look at PAC and PACG, those numbers also change. And there are reasons for this, and part of the reason is because between the VES and the other studies, the definitions of angle closure disease changed. Both the studies which were done by trained glaucoma specialists showed significant rates of angle closure suspects. Angle closure glaucoma and PAC numbers are very similar in the other 2 groups. So this is the reason for the difference in the prevalences. So the old prevalence of 4.32% of the VELO-I survey actually includes PAC and PACG together. And if you combine those 2 numbers for the other 2 studies, you do find that the figures are not all that different. The risk factors in general, what is common to all studies is that with increasing age, the risk of angle closure glaucoma goes up. So in the 70+ patients, your prevalence is actually as high as 4%. Generally, women were at higher risk because they have slightly smaller axial lengths and hyperopia. And this basically tells you how your axial length impacts the risk of angle closure disease. So this is axial length divided into 10 equal groups from lowest to highest. And you can see that in the shortest axial length group, almost 75% of people have some form of angle closure disease. But what is also important to keep in mind is that even in the longest 10% in the population, about 10% have some form of disease. So you must keep in mind that angle closure can occur at any axial length, but it's much more likely at a small axial length. Anterior chamber depth, as was referred to recently, is also even more closely associated with angle closure disease. And the shortest anterior chamber depth, the 10% with the shortest anterior chamber, almost 90% have angle closure disease. Same situation in the longest hardly 5% have angle closure disease. So you can get angle closure even in somebody who has a long axial length. It's important to do gonioscopy for anybody who's a glaucoma suspect for that reason. And the total number at risk of all this is about 28 million people. And this was the figures that we did for about 2010. Today the number is probably closer to 40 million people. Blindness due to glaucoma, generally angle closure causes more disease because of glaucoma. And we had recently published this meta-analysis where we looked at all population-based studies done globally. And we found that, angle closure causes about 2.8 times as much glaucoma, blindness as open angle glaucoma. And this is something that you need to keep in mind because it is a much more blinding disease, and that the only way you can pick it up is by doing gonioscopy. What about progression? So you have progression studies, you have 2 progression studies. You have the VELO-I survey, which looked at what happened to PACS and PACS without treatment and PAC with treatment over time. So the VELO-I survey was first done in 1995. In 2000, the 5-year follow-up was done. So you called back all the patients that you had with PACS and you saw what happened to them. And what happened that 22%, 1 in 5 patients with PACS over 5 years progressed to the next stage of disease. That is, they developed synechiae or they had high pressure, but none developed disc or field changes. What about primary angle closure? These are people who already had either synechiae or high IOPs, but no disc or field changes. 30% of them progressed to primary angle closure glaucoma. The risk was higher in patients who did not have YAG-PI done. But again, none became blind. So both these conditions, you're not seeing a very high rate of blindness over a short time period. What about incidence studies? So an incidence study is basically when you take somebody, you examine them, you rule out disease, and then you follow them up to see whether anybody developed disease over time. So we did the Chennai glaucoma study in 2001, 2002. We followed it up with the Chennai eye disease incidence study 6 years later. And we looked to see how many patients who were gonioscopically open at baseline, how many went on to develop disease. We examined about 8,000 people at the baseline, and then by the time we finally excluded people who had cataract surgery and who passed away and all that, we had about 3,300 people at the 5-year follow-up. And what we found here was that 4% of these people who were normal 5 years ago developed some form of angle closure disease. Most commonly it was PSCS, but some of them did develop PSC too. So these are patients who have been gonioscoped, we think it's open, but they still progress to go on disease. So that's why age is such a large risk factor for angle closure disease. What were the risk factors for people who were normal and went on to develop disease? They had slightly higher IOP. They were more likely to be hyperopic, much more likely to be hyperopic. There was no association with age, gender, or BMI in this cohort. AC depth was very strongly associated with risk of disease, as was axial length, lens thickness, and the absolute and relative lens positions. In fact, if you look at this slide, what you're seeing here is in people who had an axial length of 2.5 mm, 14% of them went on to develop angle closure disease over time. As the axial length became longer, the incidence came down. As the anterior chamber depth became wider, your incidence came down. Lens thickness, again, you see a similar level. Once you had lens thicknesses of over 5 and 5.5, 8 to 10% of patients went on to develop angle closure, which is one of the reasons why the lens vault becomes a problem, because when you have a very bulky lens, you're more likely to close up. In terms of biometry, axial length less than 21 millimeters, 20% chance of progression. AC depth less than 2.5 millimeters, 14%. Lens thickness greater than 5.5%, 10.1%. So these are all patients who had open angles. If you see anybody with parameters like this in your clinic, you know that these are the people who are more likely to develop an issue. The incidence rates for PSCD are actually lower than those reported by other studies from China and Mongolia. And the reason for this is those studies were primarily done in high-risk groups, while this was done in a population which was basically screened and normal at baseline. So what are the other factors? One of the other factors that's really important is that most of the glaucoma that we know is undetected. In glaucoma, in India, 90% of patients with glaucoma were undetected at baseline. And the other common issue that we had was misdiagnosis of PSCG. So what happened is, when you look at patients who are diagnosed to have angle closure in this study and in the Andhra Pradesh eye disease survey, and then we asked back, did you know that you have glaucoma? And we had a few patients in both studies who knew that they had glaucoma. And then we looked at the proportion of people whom we had diagnosed as PSCG, who were being treated as POAG. And what you find is in both these studies, between 60 to 70% of patients with a prior diagnosis of glaucoma actually were being treated as open angle glaucoma when they had angle closure. So if they had had the YAG-PI whenever it was first detected, you could potentially have prevented further progression of disease. So this is, angle closure is a huge problem in India, and these are the estimates that I spoke to you. So in 2020, our estimate is that 46 million people have some form of angle closure disease in India. In 2050, which is not all that far off, 90 million people. So 90 million people is more than the population of about 1/3 of the countries in the world today. And that's the sort of disease numbers we are looking for. So we are sitting on a potential explosion of angle closure disease in India, and we need to be sensitive about it, and we need to look for it. Thank you.
Thank you, Ronnie. As usual, well done. And now you go on to your